Are there actually other drugs as good as Keytruda or better? You know, because the health minister has acknowledged that Keytruda could save about 120 lives a year. But are there others ahead of that that are better, and there's more evidence that suggests they're better value for money?
Yeah, so after that review, they've said this isn't in the top tier of medicines that we would like to see funded. That's why they've said, compared to everything else, a low priority. The context
but how many?
Is about 20 at the moment that we're actively working on would have a high priority recommendation from those committees.
But they're not necessarily cancer drugs, are they?
Well, there are some cancer drugs, certainly. There are also medicines for infections, both viral and bacterial, and a whole range of other things like vaccines for things like shingles and chickenpox and other things. So you know, there are a lot of options.
But shingles, because the thing is, people will think shingles, that's not a life-threatening disease, not like melanoma.
Yeah, so there are a range of different types of treatments that have different sorts of effects. So absolutely, melanoma in the late stage is a life-threatening disease. There are other cancer treatments that we also have that we're evaluating that, if you like, are in the same sort of situation. They're life-saving treatments, potentially. And the question is, does the evidence that's put together actually show that that's the case? And that's really quite important when what we're trying to do at Pharmac is fairly evaluate all of the options and really come up with things that can make the biggest difference and the best impact for New Zealand patients.